Hi and welcome to Steps to Strides with me, Connor Ratcliffe, and today we're back in the garage gym looking at some potential strategies for loading our peroneals. Now today's exercise is a single limb tiptoe raise modified for peroneals, and if you're looking for an easy regression on this, then check out our video on double limb tiptoe raises modified for peroneals. So first things first, off the bat, when we're doing loaded tiptoe raises, we want to make sure that we're not going to overload the forefoot and just cause another issue or problem. So soft mat, thick socks, you can do it in trainers, but that can modify the exercise a little bit and limit the range of motion. Or plush carpet, anything that's just going to mitigate the load a little bit over forefoot should reduce the risk of any irritation in that area when we're doing reps, especially in modified exercises like this where we're specifically looking to increase load over a particular area on the forefoot to get that more targeted bias to our structure. In this instance, peroneus longus, peroneus brevis primarily. So nice easy setup. We're going to go into a single limb position for this, and I'm going to separate out balance just so it makes it a bit easier for me to be nice and controlled and get that specificity in the targeted structure that I want, rather than trying to balance and being all over the place and kind of engaging multiple muscles. Now we're still going to engage our primary plantar flexus, gastrocnemius soleus, as well as our others, tibialis posterior, long flexors, but with our Q and our modification, we can bias the load a little bit more to those target structures, the peroneus longus, peroneus brevis, by trying to engage a little bit more plantar flexion and eversion. So we're going to use a typical 1-2-3 tempo that I like to use, easy to remember, and it helps bias the eccentric phase of the contraction. But the key here is that we're going to cue to load under the first. So feel all the pressure underneath the big toe joint, feel all the pressure under the big toe, feel the pressure in this region, whatever you need to say to give that sort of fancy term verbal augmented feedback to your patient to make sure that they understand what they need to do. You can even use a little bit of like a kinesthetic cue, or sometimes it will be described as proprioceptive neuromuscular facilitation. Big words make you sound fancy and like you know what you're talking about, FYI. But basically what that means is we can even sort of push in that area, or when our sort of patient or client's undertaking the exercise, we can say to them, okay, you know, feel all the pressure here, you should feel the pressure there. So lots of strategies for this, but you just need to work with your patient to make sure that we're getting that movement that we want to achieve, rather than it just being another unconsidered exercise, and we lose all of that extra specificity to get the bias to our target structures. So here we go, nice and easy, and we're going to come up for 1, hold for a count of 2, come down for a count of 3 with our 1-2-3 second tempo, and again all the while cueing, right, pressure through the big toe, pressure through that big toe joint, pressure through the ball of the foot, feel it here, and come down nice and slowly. So if we have a look at this from behind, we can see the difference from unbiased to engaging our cue. So if I do this without thinking, I come up into this position, but when I engage my cue, remember, feel all that pressure under the big toe, feel all the pressure underneath the ball of the foot, boom, puts me into that position. And you can see the difference in how we engage a little bit more, eversion, and then when I perform that movement, I feel a little bit more engagement, lateral ankle, and in lateral compartment of leg. So I'm feeling it where I want to, we're feeling it around here, feeling it around here. And we can check with the patient all the way through, so we can start to make sure that the movement is specific as we want it to be to achieve our therapeutic aim. In this instance, broadly, just loading up peroneus longus brevis. So up for 1, hold for 2, down for a count of 3, feeling all the pressure through that big toe. Then we'll just have a look from the side. So again, this is where you can check for engagement, and you can prod, poke, palpate to make sure that you're getting engagement through that target compartment. Feeling the pressure under my big toe, feeling the pressure underneath the ball of the foot. Come coming down nice and slowly for a count of 3. So that's our single limb tiptoe raise, modified for the peroneals.